I am an active person in retirement. I enjoy working out. I go to the gym quite frequently. I train with a trainer 1 day a week.
Paul and I have been working together now for 5 years. When he first started working out with us, the shoulder wasn't as big of an issue. I think over time it just slowly got worse.
I've been living with the progressive arthritis at a state where things just weren't working right for at least 3 years.
His range of motion was extremely limited. Even reaching his arm overhead wasn't really possible.
As it became evident to me that I needed to do something with my shoulder, I began a research process of what might be available to me in the Northeast, New York or Boston primarily. It became evident to me that I needed to do some research in Rhode Island before that.
Mr. Zimmerman is someone who came to see me for debilitating pain in his shoulder, stiffness, difficulty sleeping, and really he's in his 70s, but lives a lifestyle much more of someone in their 40s or their 50s. And he's someone that we like to try and put an implant in that's going to give him the best function of his shoulder, and also if he does need to have something redone in the future, he has options.
He was very descriptive in terms of what he felt he needed to do to repair my shoulder.
The right Tournier Simplicity shoulder system is something that allows us to put shoulder replacement in with removing less bone. So a normal shoulder replacement has some element of a stem that goes down the center of the bone, and then the ball goes on the top to replace it. The stemless component, as you can see here, it's much smaller, much shorter, and then the ball attaches on top.
He wasn't rushing me, he was listening to me, so I just ended up scheduling the surgery that day.
Once the patient has decided to undergo surgery for their shoulder replacement, they will likely get a CT scan before surgery. And there's new software that we can use where we can actually virtually do the surgery before they even show up. So there's really no surprises in the operating room. It's one of the ways that we're using technology to really benefit patients and really make a difference.
Dr. Paxton was very upfront about the length of my stay. It was only going to be 1 night. If things weren't working out well, it would have been 2 nights.
So surgery takes anywhere between an hour and 2 hours. Generally 1 night stay in the hospital for most healthy patients. The next day they'll be in a sling, they'll work with therapy, they'll learn some exercises. By 3 months most patients are getting ready to go back to full activity, and by 6 months they're really cruising along and doing quite well.
He came in the next morning and liked what he saw, and I was discharged. My stay at Miriam was absolutely wonderful. The discharge was seamless. I can't say enough good things about Miriam Hospital.
After Mr. Zimmerman's surgery, he has now regained essentially full function of his shoulder. He has full strength, full motion, no pain.
I worked very hard at physical therapy. I opted to use Vanderbilt's rehabilitation facilities down here at Newport Hospital. I utilized those facilities for about 2 months, coming 2 to 3 times a week, and they were wonderful.
So at the Total Joint Center at the Miriam Hospital, we have teams and staff that are very familiar with all of the pre- and post-operative care that really, round out the entire experience for the patient and allow us to get very good outcomes. Mr. Zimmerman now is doing excellent after his shoulder replacement. He has no real restrictions with his shoulder. It doesn't really affect his daily life in any way.
We're 1 year and 5 months out after the surgery. I can definitely say that Paul's shoulder is not only back to where it was pre-surgery, but it's better than I think I've probably ever seen it. He's able to do things now that I haven't seen him do since we first started working together, which is really incredible.
The surgery actually was a life-changing event for me. The type of procedure that I went through, I would honestly recommend to anyone that is suffering to the point that their lifestyle is affected. Do not wait. Find the right surgeon and go to Miriam.